you talk to CEOs, CFOs, executive leaders in healthcare all the time. What are the things that they are looking for when they're looking at how this process is facilitated within their organizations?
And I love that question, but before, that is one of my favorite things to see that starting in one department. And then it's, you get, and many times it's even seen at the board level, where you have one department, it's somewhat of an experiment to really build in process, really have that full life cycle management brought in, and then seeing that spread throughout the organization and the ROI expand as it spreads. So I think that's a huge thing that is, I think, one of the best parts about our job, to see that efficiency in one spot and then kind of move to different parts of the organization. And we should do a whole other segment on the elevate. Sorry, I've got the Friday thing as well. The evolution of a health system
Yeah.
and contract lifecycle management too, like where you're starting at from an organization standpoint, moving to process, and then even other departments. But anyway, so really what I see from an executive level participation is, can you keep us protected, is one of the biggest. And coming from a chief compliance officer, they are much they're able to report on a lot of the information that allows them to sleep better at night, especially with canned reports that can be written, can be built out and scheduled to hit at a certain time. I think that's a big one that is somewhat of an insurance policy, to be able to know we're here, we have this information, we know we're good. And I think the other one is, I mean, we say it goes back to protection, it goes to organization, to make sure that we're efficient, and then in what we're seeing, the data that we're seeing come out of it, and whether it be physician, vendor, it could be really, really anything down the line, that we have everything under one house. And the other is just straight process. Are we getting the most out of what we have? I can't say it enough. I mean, resources are so precious in a health system, and are we making the most of those resources so they can look at what's most important for the organization and not be bound in a specific contract for days and days on end.
Yeah, you bring up two really great points. Well, lots of great points, obviously, through this entire conversation, but two that just stuck out to me. One is in relation to making sure that you have essentially that insurance policy, that you're maintaining compliance. Regulatory compliance fines can be crippling to a healthcare organization. I mean, we've seen them, you hear about them in the news, you read about them in different, articles that come out, and being able to show mitigation of that risk, evidence of mitigation of that risk, not only impacts your compliance officer because it helps them sleep at night, but your CFO, clearly, because they're not thinking about, gosh, on already fairly, in many instances, slim margins in the healthcare space in which we live. I'm not going to want, I want to make sure that I'm not going to be fined millions of dollars. But it also goes back to something that someone's told me for many, many years. You want to make sure that in your market, you're the best at what you do.
That's right.
And,
And
obviously.
so many things are affected by contract management.
Exactly. Yep.
I mean,
I
even
mean,
recruiting, and I love that you brought up revenue and top line, because I mean, I think that's something that came somewhat later on when looking at real value. Can we get from the recruitment of a physician to reimbursement? How quickly can we get there? And the faster that we get there is the more we're affecting revenue. Because it was looked at it as a cost saving measure for so long and a compliance measure. I think that's an added benefit that is still getting recognized more and more.
I think what is really interesting around the evolution, again, our topic is evolution of contract management, is really the impact on the communities themselves. So when we think about contract management, and I think you and I have been in this space for so long, I started out thinking this is really administrative, right? Contract management's administrative. It's sitting on the administrative side of the hospital. It's sitting in the compliance area. But it has such a downstream impact across the organization and the care in which our healthcare systems are providing to the communities. It's not just administrative. It really does impact the clinical side of the healthcare organization.
And I think that's why we're starting to see a lot more of the operational side being involved, physician services, the CMO. I mean, looking at, what physician contracts do we have on, and how that is really used in the managed care side.
Occasionally, I know that you would sit in meetings and we would have conversations about executives that you were sitting with, and it would be one or two chief medical officers that were coming to the conversations. I would say out of 10 you would say there would be a chief medical officer at one. Mm-hmm. You're seeing that likely?
We're seeing that quite a bit more now, and yeah, you're right. In the beginning, it was really looked at as an administrative, and I think the acceptance of really a need to address the compliance side. Everything takes time. Mm-hmm. And I think it's accepted a lot more when there's a neighbor or a competitor that gets in trouble, and we've seen that before. And then you could see it a certain radius, right, around them, where they read the newspaper and say, we really need to address this because it is an issue, and it can have some pretty dramatic effects if there is a CIA process that has to go through. But yeah, I mean, I think we're seeing definitely the CFO is interested, but we're seeing the COO and CMO also taking a very big look at this and understanding the benefit, especially when it comes to everything that surrounds a physician arrangement.
Mm-hmm. What I think one of the things I've seen contract management do is bring different champions and stakeholders to the table, mm-hmm, which ultimately helps impact the culture of the organization, because they're all working towards the same goal, whether that's in relation to what contract lifecycle management needs to do because it impacts your financial and your clinical areas, but how you want to make sure that you're aligned on regulatory process and organizational process. So we talked a lot.
One quick thing on that, and everything goes back to COVID, at the level. But I mean, I think we saw some real examples, there when we, especially early on in early 2020, the spring of 2020, we saw a complete migration to remote work environments. And we started the conversation with, take it out of the filing cabinet and move in here. There was a lot of that still going on, in specific departments across the country. And I think we really got to see or understand more about what process and a good system in place really means. And I know that there's some fantastic stories that, Stephanie, I know that you work with so many of these organizations, when really just looking at PPE, when we were out trying to find and negotiate PPE, who has to sign off, have we routed this completely? And it was the wild, wild west for many folks, but those who had a system in place and could do that efficiently, they had the advantage.
I would agree. I would say that coming out of COVID, we saw a couple of things in relation specifically to contract lifecycle management. One, the organizations that did it really well or already had something in place so they were able to easily transition, identified opportunities for optimization because they saw some areas of success, additional success, I would say, to build on what they've already put in place. The organizations that knew that they needed to do something but were kind of feeling the pain of it, so maybe they had a contract management in place, maybe they were toying with workflow, realized, okay, we've got to get something. So we started seeing a lot of discussions with our client base and with organizations that weren't doing it as optimally as they had liked, started talking to us about how do we get there, right? Like, we're halfway there. COVID really exposed us to it, so how do we get the rest of the way there?